It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network. Of course, featuring some of the best physicians in all of the Houston area that are helping to change people's lives.
Candace, exactly right. Helping change people's lives as well as helping save people's lives. Like our first best doctor, Dr. Annie Varghese, who helped save an individual's life. A remarkable story.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varghese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory. Found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and he had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varghese is her concern for her patients and her constant drive or constant searching for things to help them. Not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
Kimberly, who loves to travel due to her job, could hardly walk due to severe foot pain until she met Dr. Gabriel Maislos. To find out more about Kimberly's story and other life-changing stories, log on to bestdocsnetwork.com.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
The difference with the sleeve compared to the gastric bypass is that there's no malabsorptive component to the surgery. It avoids some of the long-term issues that can happen with the gastric bypass. In particular, there are very few vitamin and mineral deficiencies later because everything goes down the normal way. The gold standard operation, of course, is the gastric bypass. It's been around for 50 years. It has very predictable weight loss. What we're seeing is patients who are a year out from surgery who've lost 60, 70, or 80% of their extra body weight.
Well, I had what's called the Roux-en-Y, is where they make a small pouch out of the stomach, and they divert part of the intestines so that I have a little bit of malabsorption. So I have to supplement my diet with several vitamins that would otherwise not be absorbed through part of the intestines.
Jean had gone and had a lap band operation done previously with another surgeon. And like some of the lap band patients, what she'd experienced was a frustrating cycle of having the band adjusted to a certain tightness and getting some difficult symptoms from that, only to have it loosened to make those symptoms go away, and then losing a little bit of weight and then gaining it back. And she has lost somewhere in the neighborhood of 2/3 of her extra body weight from the level that she was with the gastric bypass. 2/3 of the weight has gone away.
My friends comment that I have more pep in my step, and I'm able to work more days in a row and longer hours and not feel fatigued.
I looked at the breakdown for the last 12 months, and it appears that about 74% of the patients are choosing the laparoscopic sleeve gastrectomy. Most of the rest of the patients are choosing a gastric bypass. And we're doing very few lap bands currently, mostly because the weight loss just isn't as predictable with the lap bands, and there are some long-term issues.
Go to the seminars, especially Dr. Marvin, who is very open, explains things in a very simple way for everyone to understand. We have numerous support groups here in Houston, and that has been my main success.
For more information on any of the doctors you've seen on today's show, be sure to visit our website. It's bestdocsnetwork.com. Now let's get to know our next best doctor is gynecologist Dr. Maurice Leibman.
Probably for the better part of 10 years, when I would cough or sneeze, I would release urine.
The leaky bladder is extremely common. And I think one of the biggest issues is that women just don't like to talk about it. They think they have to put up with it, or they're somewhat reluctant to talk about it in the office to their doctor. It
finally got to the point where it was interfering with stuff. I had to carry extra underwear and clothes to work, or I'd have to go home in the middle of the day, and it was I don't think anyone ever noticed, but I felt embarrassed and uncomfortable, and that was what finally made me decide to get tested to see if my problem was due to the incontinence that this would fix.
The procedure now is also a minimally invasive procedure, and it involves placing a small piece of mesh underneath the urethra. That's the tube that goes from the bladder to the outside, and it forms just a hammock or sling underneath the urethra, and when placed correctly, it has an over 90% chance of success.
After I had it done, I told Dr. Leibman I wish I had done this 5 years ago, because it made that much of a difference. But I thought I was too young, and so I convinced myself, oh, you don't have this, it's something else. This isn't going to fix your problem, and so I just didn't ever talk to him about it. So I should have talked to him sooner.
The recovery is also just wonderful. It's done as an outpatient. This procedure is still done as an outpatient in a outpatient facility or freestanding outpatient clinic, and the patient will go home, again have something to eat, maybe take some pain medicine, but very little discomfort associated with it.
I sneezed, nothing, not a single drop, and it's been 2 years now. I mean, it's completely changed my life.
Very little discomfort associated with it. And what's really nice about it is that it's effective immediately. If it's going to work, she'll tell you the next day she hasn't leaked, much to her surprise.
If you eat healthy, you're going to be healthy. So what are the major rules for eating healthy? First of all, eat breakfast. It takes your body off that emergency that you've been on overnight. Emergency isn't good for your body. It causes lots of problems with blood pressure and cholesterol. Secondly, eat anything that is red, orange, or green. Those types of foods that are red, orange, or green tend to have what's called phytochemicals. They tend to be antioxidants and they prevent heart attacks, strokes, and many cancers. Eating a Mediterranean diet is a great idea. The Greek people have a wonderful idea about what to eat. They eat a lot of beans, a lot of fiber, not much in the way of red meat that's high in fat. Fish is an important part of your diet. We need to eat less red meat in America and more fish, and also more non-red meat like the white meats like veal, chicken, turkey. Red meat has more cholesterol. Also, barbecued food is not a good idea. The barbecued flavor occurs because the smoke deposits chemicals onto the surface of the meat that taste good, but they also tend to be cancer-causing chemicals. So limit your barbecue to once a week.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Gosh, I was young, maybe about 6 years old, and was tagging along with my older brother playing golf, and I just so happened to get too close to him when he was teeing off and got hit with a backswing right in the nose. And from then on, that's when the problem started.
Joey came and see me because he can't breathe through his nose. So he has to breathe through his mouth. He doesn't sleep well at night. He snores a lot, and that makes him tired all the time.
You know, you would sleep through the night but wake up and not feel rested. You know, even though you made it through a whole night and got a whole night of sleep, you just wake up and feel like, gosh, I really don't even feel like I slept at all.
When we examined Joey, we noticed that the wall in the middle of his nose, what we call the septum, that separate the left and the right side, was crooked, in his case, was crooked on the right side, you know, causing him problem to breathe through his nose. And we agreed upon a treatment plan that consists of first a surgery to correct his septum, to straighten up his septum, so to improve the nasal airway.
Very simple outpatient. You know, everything was explained to you. Go in the morning. I actually took a little nap right before surgery because it was early in the morning. Woke up and that was it. So it was real simple, real easy.
Joey's quality of life has improved tremendously. He breathes better, he sleeps better, and he enjoys life more.
Well, you know, you just don't realize it because I've had it for so many years. You just get used to, you're thinking the way you're breathing is normal, and it's not. And then once it's changed the way it is, you know, I'm able to do things without getting winded, you know, because I'm not having to open my mouth to breathe now. I'm able to breathe clear through my nose.
The number one reason that patients come and see me is because they can't breathe through their nose. In most of the case, there's a solution for that. As a center of excellence in nose and sinus disease, I'm always in the forefront of medical research to improve my patient outcome. Medicine has advanced so much that there's always a solution to breathe well and live well. Patients don't have to suffer anymore.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
The reason why I chose breast augmentation was because my breasts were smaller than all my friends. I had the smallest ones, and you know, it was never fun wearing a swimsuit. And
Megan came to us looking for breast augmentation, and it's a surgery that allows her to fill out her clothes, fill out the fashions that are popular, and have more confidence in herself and her appearance.
When I was trying to figure out the size, I didn't want like something that looked fake. I kind of wanted to look natural. And
with the breast augmentation, we'll see someone for an initial consultation, and then after the initial consultation, you'll have a preoperative visit. And the surgery itself, they'll come in that morning, they'll meet with our nurses and our anesthesia staff, and then the surgery itself takes about an hour.
I got the breast augmentation done on Friday, and I returned to work on Tuesday, and I really didn't take the medication as much as I should have, which was fine because the procedure, I healed pretty quickly.
I think in general, the ability to have an operating room in our office allows us to control the entire experience. And so from the second you walk into the office to the second you leave, and as seen at your 3rd and 6th month follow-ups, the experience is controlled by myself and Dr. Bancroft. The Quad A SF is the gold standard for outpatient ambulatory surgery centers to be credentialed in and accredited by, and so we have voluntarily have gone ahead and gotten certified. Unlike many other surgeons who do it in an unaccredited or non-accredited facility, you just don't know how safe it is to do it there, and they may be very capable or they may not have all the equipment they need.
I feel a lot more confident in myself. I feel better when I wear clothing. It's more fun to put clothing on.
Patient selection is important, and making sure that your ability to deliver results are in line with their expectation. If their expectations and your expectations are aligned, they're extremely pleased with the surgery and being able to do it in the office in a comfortable environment where they're familiar with the office staff. And so as long as you select the proper patients, then patients are very satisfied with breast augmentation or any of the other surgeries we're able to do in our office.
For more information on any of the outstanding doctors you see on today's show, of course, you head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And now we're going to meet our next best doctor. It's radiologist Dr. Stephen Rose.
One of the things that I learned early from Dr. Tabar, who was the person in Sweden who did that 2-county trial, and that was my first introduction to real quality mammography and how it should be done. But I learned that we needed to work together and you needed to understand the pathology. So immediately the first benefit was to work closely with the pathologist.
Dr. Rose and Dr. Sutton enticed me to go to a meeting out in California where Dr. Laszlo Tabar was speaking on mammography and sophisticated ways to diagnose early breast cancer. And to say that I got hooked by Dr. Tabar would be an understatement. And so we came back in late 1995 and determined we wanted to form a comprehensive breast center.
At the time that we started this format, we were really the only area in Houston, outside maybe the medical center itself, in which this was a routine sort of event of meeting on a weekly basis with all the different physicians involved with the breast cancer diagnosis and treatment planning.
It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are.
I think the most powerful thing that we have been doing for close to 20 years is the weekly conference, and it's dedicated to women who are recently diagnosed.
And so it takes an element of commitment on all the different parties involved, but at the same time, when you see the benefit of that as far as our ability to do a much better job taking care of the patient, it's worth every second.
So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team.
I was experiencing chronic migraines 24/7, so 24 hours, 7 days a week. The only relief I was getting was sleep. So I would be willing to try anything. I would go to a neurologist. He tried every medicine in the book. Couldn't figure it out. He says, I met a doctor with the new procedure for stimulation for chronic migraines. Okay, let's go, let's see what happens.
The specific treatment we do here is an implanted neurostimulator for severe headaches. It's a unit that goes completely under the skin. It's somewhat akin to a pacemaker for the heart. There's a very small battery that's implanted under the skin, and from the battery, typically 4 very thin little plastic covered wires are passed up under the skin, 2 in the back of the head, and 2 of them end up right above the eyebrows. It's all under the skin. In fact, you can't see any scars or lumps. But once it's in, when it's turned on, they'll feel just a very mild tingling sensation in the front of the head and the back of the head. And by certain mechanisms, when they feel that, it very commonly either stops or dramatically improves their headaches.
After the stimulator was put in, I could see a dramatic change. I didn't have to take any medication. Except for a cold front coming in, I would just take a daily Advil Sinus or a Toenail Sinus just to kickstart it. And then once I get my headache under control, the stimulator could take over. That's when I knew this was going to work.
Michael had these severe, basically daily, devastating headaches. Michael Parker kept on with life. He refereed the sporting events around here with the kids. So he was fighting through it, but it was still greatly limiting him. So it's been a couple of 3 years now since we put it in. Michael has done great.
Whoever has migraines out there, take a look into this, because this can change your life as it has changed mine. I would drop dead to save that man because he saved my life.
For more information on any of the outstanding doctors you see on today's show, of course, you head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. More information, more videos, please check that out. Right now, time to head to our next best doctor. It's oral surgeon, Dr. Paul Metz.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in 2 settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a 3-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So it from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
I'm an athlete.
I am a World Series champion.
I'm a hockey player. I'm a football player. I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer.
One simple test, and you could save your life or someone you love.
Get screened. Be a part of 1 million strong.
Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. Patient would be in the hospital for a week, and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. Went home in the car, and really I was up and walking around within, just that day I was up walking around, on my own.
It's a very new procedure, and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine.
I think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.
I came for the treatment for my toenails most of all, but all my all my toenails were bad, really bad. They were in bad shape and they were discolorated, like some white stuff on them. How to say? They were disattached from the nail bed in one place especially, and was kind of yellowish too.
Ms. Ina Yashova came to my office complaining of fungal toenails. Very common thing, especially you see it in summertime. It's very prevalent. It's a fungal infection of the nails. The nails are discolored, and she wanted them treated.
I keep my body in shape, and I want to be healthy, and I want to have everything perfect. So it's one of the things when I found out that something is wrong. I couldn't go for some time because I was busy, but I told to myself, no, I have to.
It's basically a YAG laser, and it creates this intense heat, and it kills fungus, bacteria, virus, and it kills it at the root of the nail. That's where the nail begins. From that point on, we have a protocol in place to prevent reoccurrence, because probably most of the problems that have occurred in the past is even prior to the laser with the oral medication was that you would get rid of the fungal infection and then it would come back. So you also have to do your part to make sure that you don't get a recurrence, because once you're susceptible to fungal infection, you remain susceptible the rest of your life.
I figured out that I have good results because when I could see there my nail growing, the new nail will come pretty and doesn't have anything, like no fungus, nothing, no discoloration. It was pretty and nice and healthy nail.
The risk of a fungal infection is not just the appearance, and so you don't want to wait on it. You want to make sure you come in early because you don't want to go to that severe category where you might require multiple treatments. It's better to treat it early on. Not only that, the nails, when they become fungal, they become yellow, thickened, discolored, hypertrophic, and you can develop ingrown toenails. That's a serious risk because that's an infection, and that requires a surgical procedure.
I got new nail bed, new nail, and it was like pretty healthy.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in all of the Houston area that are helping to change people's lives.
And for more information on any of these great physicians, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.